All these people belong to different age groups, caste, place, and social backgrounds. But they have one thing in common: they all are HIV positive. AIDS respect no boundaries. It crosses all barriers from male to females, rich to poor, educated to uneducated, and then
Hello friends. In this program of study on HIV and family education, you have read about a wide variety of topics such as family life education, HIV, AIDS, substance abuse and how to take care of people with these infections. This was the theoretical part of the course. Now, you're supposed to carry out a project work based on the various units and subtopics of your choice. While developing the project work, different target groups are to be kept in mind. Some of the projects are limited to writing a single but comprehensive report, while others comprise 2 to 3 reports at a time. Let us start with the first option. Under this option, you will have to carry out a project work on any of the topics of your course material. You can select the topic of your own choice, but while deciding about the topic, keep various factors like the relevance of the topic, availability of related literature, time, and finance in mind. So let's start with the project work.
indirect method which helps to acquire fresh information in an organized way. Systematic approach for collecting new facts, tabulating and analyzing data, and discussing the findings. The outcome which is to be submitted in the form of a dissertation. The students could start their project work once it is approved by the supervisor, who will also supervise the project. Now let us discuss the steps involved in project work. The first and most important step is topic selection. One should always choose topic which interests him or her and for which resources needed are available. The entire course material will act as a reference and each unit or even sub-unit can be taken up as a topic. In this way, you will have numerous topics available from the blocks given to you. After you have selected the topic of your choice, it is important to discuss it with your supervisor. Your proposal should ideally be of about 1,000 words, clearly stating the problems, objectives, sample size, methodology, etc. The supervisor will go through your proposal and return the same to you with remarks within 15 days. Now, you should start working on tool preparation, which will facilitate you to collect information. The tools may include interview schedules, observation methods, etc. It should be ensured that adequate number of questions are included in the interview schedule so that no information is left out. Next step is data collection, which is considered as the base of your whole project. You have to collect data using your tools. In case of filling your interview schedules, you will be required to develop rapport with your respondents in order to get better and correct responses. The collected data has to be analyzed with proper concentration. You can make proper notes, assign quotes, and transfer the raw data into a sheet on which various statistical techniques could be applied. The information that you have obtained from interviews and case studies can be included in the report as supporting evidence. This analysis of data has to be presented in the form of a report. An ideal report is divided into 5 chapters, which are Introduction, Research Design and Methodology, Data Analysis and Interpretation, Suggestions or Recommendations, and Summary. You have to submit this report of about 50 pages. Don't forget to show the report to your supervisor and seek his or her guidance before you go for final typing and binding work. It is important to submit a declaration that the work is original and has not been submitted earlier to this university or any other institution. You will also have to attach a certificate from the supervisor that it is a genuine and original work. The approved project proposal should also be included in the project work. The project report should clearly indicate the enrollment number, the program of study, the name and address of the student. So these were the main steps involved in project work. Let us quickly look upon these steps once again. The first step is topic selection, followed by preparation of tools for data collection, analysis of data collected, writing a report, and submission of a final report. Now, we will learn about the guidelines for the preparation of a project proposal. The first step in preparing project proposal is the title of the project. This should clearly specify the type and nature of the project. Second step is the statement of the problem. That should precisely contain an analysis and relevance of the problem. You should clearly state your intention for carrying out this project in the form of objectives. Hypothesis is a probable answer to the problem you have undertaken. You can even avoid it as you are expected to make only a mini survey. Let us now take an example to study these steps. We are taking the project title as Extent of Awareness on HIV or AIDS among college students. In the statement of the problem, we have to explain the efforts being made by the government and NGOs to create awareness about AIDS. It is widely claimed that college students are aware of HIV and AIDS. However, this is only partly true. There is still a lot of misunderstanding and misconception on the subject, so we have to deal with this problem.
Our main objectives will be to find out about the extent of HIV/AIDS awareness among the students, as well as the methods used by the government and NGOs to create awareness on the subject. The universe of the study will comprise all the students enrolled with the University of Delhi. A sample of about 40 students can be taken from different colleges. Students from bachelor's degree program only will be covered. After this, an interview schedule may be used for data collection, and the collected data can be analyzed. The data analysis should be done keeping in mind the objectives of the study. This was information about a small project work based on data collection. In the next option, there are 3 exercises, and the students opting for it will have to attempt all the 3. Each exercise should be of 10 to 15 pages. These exercises are:
Case study of an individual or a family. Case study of an institution. Survey report of healthcare facilities in your block or district or town. Name, age, gender, educational qualifications, occupation, place of residence, family background, whether it's a joint family, extended family, or a nuclear family, economic background, and religion, which plays a major role in various aspects of life. After recording these basic details, the student should find out the problems and the causes that an individual or family is faced with. The student should also find out the attitude of the family members through interaction with husband, wife, parents, and children. After recording these details from the client, the researcher could speak to the neighbors, friends, and colleagues of the family to record additional information.
At the end of the report, there should be unbiased comments and observations of the researcher, which will form an important part of your case study. Similarly, writing case study of an institution is same as that of an individual. The points that need to be focused out are as follows:
Name of the institution, address, the name of the chief coordinator or manager, areas of work, staff strength, their funding source, their infrastructure facilities, recognition and awards if any, types of clients, types of problems, feedback from the clients as well as the staff, and feedback from the management or administration. However, unlike the case study of an individual, there is no need to hide the actual name of the institution. Names of responsible people can be replaced if such a request is made by concerned individual.
Here we are taking the case study of an NGO called Sahara Home. Sahara Home is a pioneering NGO in drug treatment and in the field of HIV and AIDS. The roots of Sahara lead back to 1978, when an informal therapeutic transitional community was set up with the desire to serve God through interactions with persons using substances. It was formally registered in 1985.
The early 80s saw a massive influx of hard drugs entering India from the Golden Crescent, which initiated a thrust to provide treatment services dependent on drugs, chemicals, alcohol, and people with mild mental disorders. With the entry of injecting drug use came HIV-related opportunistic infections, and the link between HIV and injecting drug use was established.
Sahara started almost 24 years ago, by a group of people who basically had a spiritual calling, and they thought they must do something for people. They identified drug users because at that time there were lots of hippies around, in Delhi in particular. And so initially it was with foreigners. But soon after that, the program started taking in Indian people, and it just grew and grew and kept growing, in fact. My wife and I came from Bombay in '83, and we took over leadership of Sahara in '85, by which time it got registered. We got it registered in 1985 as Sahara, though it started in '78. And for about 15 or 16 years, my wife and I thought we want to do this kind of work. We've come from a different kind of background of not using drugs at all. It was a kind of a challenge. And so we lived on the premises of Sahara. Our family grew up there. We've got 3 sons. We've grown up in this house. We've been warned by people, be careful. But basically we wanted to show people that you can live with hardcore people. I mean, you know what hardcore is. And with people who are HIV positive. And don't freak out. Look at it with the right perspective. Be supportive. And in the end, it really helps. People actually turn around and lead very productive lives. So as it stands today, we've grown. We've got around 33 projects in Bombay, Pune, Churachandpur, Manipur and Delhi. 99% of our staff are ex-drug users, recovered users, doing some mind-blowing work across the country for very little pay. I mean, they are carrying the organization really. Bunch of people have been given up by society. Many of them are positive people, and we're very happy for that people can make such a big difference in other people's lives.
India, being a poor country with a very low literacy rate and basically a rural agro-based population, was unable to handle the swiftness of the onslaught of the needle and its related repercussions. Sahara formulated its program objectives to include in its focus to address the unique and specific needs of persons infected with HIV or AIDS, and was one of the pioneers in the field of HIV-related infections. Today, Sahara has 33 different projects and over 180 like-minded people providing its continuum of care to HIV-infected substance users and people living with HIV in Delhi, Pune, Mumbai and Manipur.
This case study should be typed in around 15 pages. You must supplement your writing with various remarks as stated in the guidelines provided to you. You should also include subtitles and subsections. Now we will learn how to make a survey report of healthcare facilities in your block, district or town. We all live in a society, but because of our busy lifestyles, generally we don't find time to utilize the healthcare facilities available in our locality. This exercise aims to help you gather all the information regarding healthcare facilities available in your block, district or town. You can collect information through 2 sources, primary sources and secondary sources.
Infrastructure facilities like the number of buildings, number of rooms, beds, OPDs, etc. Personal resources like the number of physicians, nurses, other paramedical personnel, etc. Outdoor services or community-based services like mobile clinic, extension programs in villages and slum communities. Other programs like organizing seminars, publication of bulletins or periodicals. Secondary sources include Directorate of Health of Services, District Collectorate, Block Development Office, non-governmental organizations. Based on all these information, a final report is to be prepared which will include your personal observations. You could also provide some suggestions for improvement.
This was the information about case studies and survey reports. Now, in option 3, again there are 3 exercises. Each exercise should be of 10 to 15 pages. The 3 exercises are:
Report of an exposure or field visit, directory of NGOs in your locality, and write up on a relevant topic.
We will now take report of an exposure or field visit which you have organized for a group of people or the one in which you participated. If you want to make a write-up on a field trip, you need to follow some steps. These steps are:
Objectives of your visit. You should know about the target group, as it will facilitate you in gathering relevant and useful facts and data. Deciding the place of your visit. You need to provide an orientation to the group about the purpose of the visit and the limitations as well as precautions to be taken. And finally, as a group leader, you have to do proper preparation and planning, like identifying the agency, seeking necessary permission, and making arrangement for transportation, etc. The final report should include title page containing your name and enrollment number as well as the name and address of the agency visited, contents page. The researcher should acknowledge the institution visited and the various support staff. Introduction and background information should include information about the activities, origin, staff, and other relevant information of the institute visited. Main body should include the details about the agency, source of funds, future plans, management, etc. You can record your observations also. Materials collected from the institute visited can be given at the end as supporting documents. These may include handouts, folders, leaflets, etc.
Have you ever seen a telephone directory? You must have. In case you have the name of an individual and you wish to find out his phone number or address, you can easily search through the telephone directory. Similarly, creating a directory of non-governmental organizations or NGOs could be a great help if you are involved in social work. However, while creating such a directory, you should not be overambitious. In other words, you need to clearly decide the geographical area you wish to cover. There are several NGOs in every district, so compilation could be done alphabetically or based on the field of work like health education, social welfare, social forestry, etc. Here is a sample format for developing a directory of the NGOs.
Name of the organization, address, date of establishment or registration, registration number, the objectives of the organization, methodology adopted for reaching the target group, their publications like newsletters, magazines, etc., their funding sources, their sister concerns or collaborating agencies if any. In your case, since you have taken the NGO Sahara Home as your case study, so you can fill the information in this manner. Name of the organization, Sahara Home. Address, E453, Greater Kailash, New Delhi. Year of establishment, 1978. Year of registration, 1985. Telephone number, 621-9147. Coordinator or contact person, Shantanu Chaudhary. Objectives of the organization: to provide treatment to people dependent on drugs, chemicals, or alcohol, to address the unique and specific needs of persons infected with HIV or AIDS. Publications include We Sahara, which is a monthly newsletter. Sister concerns include Sahara Midway Home, Sahara Day Care Center, Sahara Outreach Program at Jama Masjid, Model Counseling Center at Safdarjung Hospital, Create a similar format for other NGOs also and fill up the entries neatly, and your directory is ready. You can either neatly write down the information or type it on a computer. If you intend to preserve it, you could bind it.
Finally, if you wish to submit a write-up on a relevant topic, it is important to factually support it with relevant visuals. The idea behind this exercise is to orient you to prepare an article, research paper, or a case study for presentation of a publication or even for submission to a donor agency. Your write-up should tentatively consist of these headings.
Title, Introduction, Main Body, which should include background information, content, suggestion, and summary. Suppose we choose to write on a topic HIV in the workplace. Here, we will first collect the facts about the age group which is most affected by HIV or AIDS and how it enters the workplace, government agencies, companies, and labor unions. You can also include the response of the government to these issues and various steps taken by them. You have to highlight your objectives to research on this subject, which could be to assess the magnitude of HIV or AIDS in the workplace, to know the steps or policy decisions that are required to be followed at workplace, and to suggest strategies for responding to HIV or AIDS at the workplace. You can also include the policies framed by WHO in collaboration with International Labour Organization ILO during a conference on AIDS and workplace.
You can add your suggestions, like there is an urgent need for education at the workplace regarding AIDS. It is because when an employee is suspected or diagnosed as having AIDS, a wave of fear, panic, and confusion often ensues in the workplace. This can be minimized by providing HIV education and support services to all employees and formulating effective HIV policies. Along with this information, you need to write down details of the books, journals, newspapers, and other materials you have referred for developing this article. The next option is about preparing a report of a community organization program on health-related issues. This exercise is basically meant for the persons working with NGOs. There are certain important steps that are suggested for collecting information and writing a report.
Here we are going to tell you about a community organization program in Ramtapura village of Gwalior district in Madhya Pradesh. This is a small village comprising nearly 45 families, most of them economically backward, with many diseases, especially leprosy being a common phenomenon. The village panchayat, with the help of an NGO, decided to start an awareness campaign with the objectives of identifying the symptoms of leprosy, providing knowledge about the causes of leprosy, and providing information about the preventive measures and treatment of the disease. As a means to disseminate information and creating awareness among the villagers, training camps were organized in the schools of nearby town so that these student volunteers can go to each and every house of the village and provide knowledge to the villagers. Mahila Mandals in the village also helped in the program by organizing training sessions as well as visits to the houses in the village. Now let us once again tell you about the steps you can include in your report. Location of the program, which is Ramtapura village of Gwalior district in Madhya Pradesh. Objectives of the program, which include to identify the symptoms of leprosy, to provide knowledge about the causes of leprosy, to provide information about the preventive measures and treatment of the disease. Staff engaged for the program. The program was organized by the village panchayat with some youth volunteers and district health officials. Means adopted for organizing people, which included house-to-house visits by the youth volunteers as well as Mahila Mandal members, awareness sessions in the village. Apart from this, you can also include steps like infrastructure facilities, program evaluation and follow-up in your report.
This was the information about the fourth option. This is all for now. See you in our next program. Till then, goodbye. In this series of programs dealing with the study of HIV and family education, we have already talked about reasons, prevention, and other relevant information on AIDS. Besides this, the significance of family education and the steps which should be taken by us have also been emphasized. This was the theoretical part of the course. In addition to that, you have also learnt about the methods to carry out your project work based on any of the topics suggested in your course material. Case studies and reports are other areas you must have been familiar with by now. Today, we are going to talk about the development of an awareness package through an innovative intervention strategy or method.
You will first have to make a write-up on your selected issue and the requirement for intervention. The second step will be writing down a proposal with specific objectives, strategies to be used, and the feasibility of the methodologies. After doing this, you should discuss with the experts and draw up a plan of action accordingly. A pre-testing with a small group of people is must to get the necessary feedbacks. Last but not the least, you should carry out necessary modifications and then finalize the content.
We have just talked about the diverse target groups. It emphasizes the importance to understand that all of them require one or another form of intervention strategy. Besides those target groups, we have even urban, rural, and tribal populations. They may require a completely different approach for education. Therefore, preparing just one set of material or adoption of common strategies for all target groups will be inappropriate.
The first and the foremost thing is the identification of the target group. Then, a preliminary survey of the target group should be conducted. This is done in order to acquire information about their level of education, social, cultural, and religious background, and traditional practices. Next step is the formation of a group of experts. Some members from the target group must be given representation. After that, a tentative plan of action should be prepared. The topic on which one intends to prepare the education kit should be clearly spelled out. The objectives and the need for such a program should be very clearly mentioned. Next in the order has to be discussion with the group regarding the feasibility of such an intervention. One must involve people's representatives at every stage, even though their contribution might be limited. There is also the need to get the help of experts to make comments on what must be prepared so that one is able to avoid maximum possible errors. Last but not the least, choosing right types of methods and channels of communication is also very important.
Next in our list of communication tools is a collage. It is a composition of pictures, words, or objects which have been collected according to a given theme.
The material displayed must be educative and it should be presented in a neat and aesthetic manner to have positive impact. The size is an important element and therefore proper visibility of the text should be ensured. Each of the displays should have a suitable theme. And lastly, we must remember that the participation of the group in preparing the display is extremely important, so it must be taken care of.
Good knowledge of communication is essential if you intend to develop an educational kit or aid. Therefore, you must go through block 1 of the course on communications and counseling in HIV, which will provide you minimum required information. The rest will depend on your imagination and innovativeness.